and I'm the student nurse who's going to be performing a thorough assessment of your thorax and your lungs today, okay? Do you have any trouble breathing or any other concerns today? No? Alright, wonderful. So I'm going to start off by inspecting the anterior chest. So it appears that her respirations are regular, symmetrical, and there's no labored breathing. Her chest ratio also appears to be a 1:2. On palpation, her skin is warm and dry. Next, I'm going to move on to percussion. So I'm going to go ahead and place my middle finger here on the clavicle and move down to the second intercostal space and just lightly tap. And then I'm also going to do that for the fourth intercostal space and on both sides. Excuse my reach. Alright, so percussion is resonant on both sides. There's no signs of hyperresonance or dullness in the chest. Next, I'm going to go ahead and palpate for tactile dermatitis. So I'm going to have the patient say the word 99, and I'm going to feel for a vibration.
99. 99.
Wonderful. So tactile dermatitis was equal bilaterally. Next, I'm going to go ahead and auscultate all the four sides that I percussed. And I'm going to listen for any adventitious lung sounds. I'm going to have the patient take a deep breath in and out before I move to the next spot. Alright, so the lung sounds on the anterior chest are clear, no signs of adventitious or abnormal lung sounds. Next, I'm going to check the angle of the intercostal angle. I'm going to place my hands kind of like a butterfly on the sides of her rib cage, and I'm going to kind of press in right here in the middle with my thumbs and have her take a deep breath in and out. So the anterior intercostal angle was equal bilaterally, so her chest expansion was symmetric. Next, I'm going to move on to the lateral chest. So I'm going to have her put her arm up, and on the left side of on the left lung, there are two lobes, so I'm going to listen at the third and the sixth intercostal spaces. But on the right side, there are three lobes, the upper, the middle, and the lower, so I'm going to listen at the third, the fourth, and the sixth intercostal spaces. So I'm going to have the patient take a deep breath in and out again, just like on the front, and I'm going to listen for abnormal lung sounds. Alright, and I'm going to do the right side. Excuse me. Alright, so the lung sounds appear to be clear, no signs of abnormal or adventitious lung sounds. Next, I'm going to move on to the posterior chest. So I'm going to have you face that way for me, please. On inspection, her chest appears to be have intact skin, no signs of any lesions, and the skin is also warm and dry. Next, I'm going to go ahead and feel for the tactile dermatitis again. I'm going to have her say the word 99 again and feel for the vibration.
99. 99.
Wonderful. So tactile dermatitis was equal on both sides. Next, I'm going to move on to listening for bronchophony. So I'm going to be listening for lung consolidation with bronchophony, egophony, and then the whispered pectoralogy. So with bronchophony, I'm going to have her say the word 99 again. I'm going to check 8 spots on the back, so just above the scapula, and then I'm going to move to the fourth intercostal space in the middle of the back, and then the seventh, and then the eighth intercostal spaces. A negative test would mean that the sounds are muffled and indistinguishable, and that is normal. Abnormal would mean that I can clearly hear her say 99 through the stethoscope, and that would be a positive sign, which is abnormal. So I'm going to go ahead and listen now with the diaphragm of my stethoscope.
99. 99, 99, 99, 99, 99, 99, 99.
Perfect. So bronchophony is negative, so no lung consolidation. Next, I'm going to do the egophony. So I'm going to have her say the letter E in each of those 8 spots again. Negative would mean that the sound again is muffled and indistinguishable, which is normal. But abnormal would mean that I can hear an A sound instead of an E, and that would mean that there is lung consolidation. I'm going to go ahead and listen to the same 8 spots.
E, 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 E.
All right, wonderful. Egophony is negative as well. The sounds were muffled on both sides. Next, I'm going to do the whisper pectorology. So I'm going to listen to the same 8 spots. This time I'm going to have the patient whisper the numbers 1, 2, 3. Again, a negative sign, which is normal, would mean that the sound is muffled and indistinguishable. Positive would mean that I can clearly hear it, which means that there is lung consolidation. All right. All right. Whisper pectorology is negative bilaterally. Lastly, I'm going to listen for the lung sounds. Same 8 spots. I'm going to have her take a deep breath in and out before I move to the next location. All right. So the lung sounds are clear bilaterally, no signs of adventitious or abnormal lung sounds. Lastly, I'm going to check again for the intercostal angle. So I'm going to do the same butterfly hands on the back and kind of pinch towards the middle and have her take a deep breath in and out. Wonderful. So the posterior intercostal angle is equal bilaterally, so her chest expansion is symmetric. That completes my
mandibular joint, which is found in front of the tragus of the ear. So what you're gonna do is open and close. I'm gonna be assessing for crepitus, tenderness, any pain doing that? No. And the next joint you're going to do is to check for retraction on the same joint and protrusion and retraction. So you're gonna bring your jaw out and back and forth. Perfect. Any pain doing that?
No.
All right. So the next thing we're going to do is to check the shoulder joints, which are about here. It's 3 of them. There is the acromioclavicular, glenohumerus, and sternoclavicular. So it's right about here near the clavicle. Gonna be assessing for tenderness. Any pain anywhere?
No.
So that's good. So for this part, we're going also to try and assess for the range of motion of the shoulders. And we're gonna start with deflection, which you're gonna do this and up. Can you do that? Any pain?
No.
Both arms? All right. And then we're going to do the extension. You do your back, arm back like that. And both arms. Then you're going to do the abduction. So you're gonna do your arm like this and up. Any pain? So we are testing all these joints. Then we're going to do the external rotation. So you're gonna do this and down. Any pain?
No.
And then you try that one. Then we're going to do the internal rotation where you do this for both arms and tell me if there's any pain.
No pain.
Right. So her shoulders are proportional to her trunk laterally, and she has passed the test. There are no issues there. The next joint you're going to check is the elbow joint. We're going to be checking the acromion process, the epicondyles, front and backwards. So we're gonna be checking for pain, crepitus. There's nothing. Both arms, checking the acromion process right there. Checking all the epicondyles. All right. Then we're going to go forward and check the wrist joints, which is the carpal, metacarpal, and the phalanges. I'm going to be bending it and checking for any deformities, nodules, pain. Let me know if you have any pain anywhere. Check. This is the metacarpal and the phalanges, the proximal digital, mid-digital, all those. You're looking for the metacarpal phalangeal joint, which is right about there for any tenderness, and there's the wrist joints and the hand joints. You know, there's the radial on the ulnar bones, checking for any deformities. Then we're going to check for the strength. I'm going to ask you to squeeze my hands with your fingers, both hands. Squeeze them. Good, I squeeze them, there is no pain. So I'm going to ask you to fold your thumb like that and squeeze. We are looking for the tunnel carpal pain, and it's negative. Then I'm going to ask you to put your hands like this. We are looking for phalanx, where she should have pain over here, and that is negative. So phalanx is putting the hands back together. So we're going to move to the spine. First of all is to assess for posture. It's normal. There is no curvature. There is no problem. We're going to look at the spinal process. Going down, feeling the paravertebral muscles. Moving on down to the iliac crest, right about here. For modesty, we're just gonna look at that much. Should be around here, which is demarcated by dimples on both sides. You're feeling for tenderness, nodules, deformities. There's nothing. I'm going to ask you to lie down and then lift your hip. So right about here, we assess for the sciatica nerve, which is the biggest nerve, and it's a common problem. So do you feel any pain there?
No.
All right. And then you can turn around towards the front, just lying down still. So at about here, we are looking for the inguinal ligament, which is about right there, and the femoral nerves, artery and vein, right about here. They intersect here. Then I'm going to ask you to fold your leg towards the abdomen. Fold it all the way towards the abdomen. So I'm going to put my arm here to feel the movement of the hand under normal, to feel the lumbar, and we feel the extension. So we're going to test for extension. So extend your leg, bring it back, and you're going to do tunnel adduction. Any pain doing that?
No.
In this position, you're going to assess the knees, checking for tenderness, any deformities, any swelling. Do you feel any pain?
No.
Good. All right. We are at this knee. We assess for the abductor, tubercle, medial epicondyle, the ligament, the patella tendon on the sides, the medial meniscus and lateral meniscus, and how they attach to the muscles like the hamstrings and the quadriceps or femoris. From there, we're going to check the spine. You can stand and bend, touch your toes. So we are looking for scoliosis. checking the back to see for any deformity, feeling the paravertebral bones, spinal process. You can sit up, there is no scoliosis. And then we're going to ask you to stand up, do the flexion, just touch your toes once again, then extend your back, stand up, and go back as much back as you can. And then go sideways and back, then go to the side front, but bend all the way like you're touching your toes. On the other side, good. So she has passed the test, that she has no problems over there, and we can continue to the. So after doing the spine and the knees, we're going to go to the ankles and feet. This is the ankle joint. We're going to palpate for any bogginess, tenderness. Then we're going to check any deformities. We're going to check for range of motion. Do you feel any pain?
No.
So we're going to assess the Achilles tendon right there, and you can feel it. It's a big tendon. There are no nodules. And we're going to feel the posterior calcaneus, plantar fascia right there. Bend your knee a little bit. Bend your knee. Bend your knee. And then the malleus. And both of them look normal. Then we're going to check, can you remove the socks here? We're going to check the metatarsals. Those are the toes. Can you move your toes back and forth, range of motion? That's good. Can you move your, yeah, you can see that. So I'm going to ask you to turn your ankle around. Then you can point it upwards, which is flexion, point it down, dorsiflexion. And we did the plantar flexion, ankle extension, and dorsiflexion. And the joints of the toes, which all seem normal. There's no tenderness, there's no deformity. Check is the hip joints. Right there, we're assessing the great trochanter of the femur, the pubic tubercle, posterior iliac spine, gluteal folds, and sacroiliac joints right about there. Then you're going to move the joints, see if there is any pain, and you're going to extend it. The hip joint, that's extension, abduction, flexion, and she has no issues. She's a young patient, but for older patients,
bumps,
we definitely
any abnormalities here. I'm also looking at the color, the distribution, the amount of hair you have, and that all feels good, all looks good. No tenderness there?
No tenderness.
Okay, great. I'm going to work my way down right to your jaw joint here. Go ahead and open and close. And then open and shift side to side for me. Good. A little bit of clicking. Does that hurt at all?
Does not hurt.
Okay, great. Now what I'm going to do is look in your ears. I'm looking for redness, discharge, any abnormalities. I'll also feel around the ear as well. All right, same thing on the other side. Great, and nothing there. While we're on your face, I'm just going to be feeling or pushing on your sinuses a little bit. Tell me if there's any discomfort here.
Just a little bit of pressure.
A little bit of pressure. Do you have seasonal allergies? Are you suffering from a cold right now?
I do get some seasonal allergies.
Seasonal allergies, okay. Next thing I'm going to have you do is go ahead and open nice and wide, checking in the mouth here, and go ahead and say ah.
Ah.
Good. Looking at teeth, gums, tonsils, which he has. Make sure everything's nice, pink, moist, good color. There's no abnormalities in there, which there isn't. Go ahead and smile for me and frown, and then puff out your cheeks, and then go ahead and stick out your tongue at me and shift it side to side. Good. And then up. Good. Okay. And then now what I'm going to do is look at your nose as well. Looking for symmetry, any discharge, abnormal discharge, color, looking at all that in the nose. You said you have seasonal allergies. Are you having any congestion right now?
No congestion, just a little eye irritation.
Okay. And now what I'm going to do is go ahead and turn off the lights. And I'm going to have you look at out at a distance there. And I'm going to bring the light right into your eyes. Just keep looking straight forward. Just watching for your pupils to constrict equally. And they do. Great. So I'm going to turn the lights back on. And now what I'm going to have you do is follow my pen with just your eyes, not your head, okay? Good. Good. And then what I'll have you do is look right at my pen, and I'm just coming right towards your eyes. Good. Now, do you wear any contact lenses or glasses?
No, I do not.
Okay, good. And then what I'll have you do here is, oh, one more thing actually with your eyes. I'm going to pull down your eyelids here, and I want you to just look up. I'm looking at color here, and they are a little pink. You said you did suffer from allergies, so that's probably what's going on right now. But we'll have to talk to the doctor about that. Now what I'm feeling is lymph nodes here. So I'm just going behind your ear. Any tenderness in here or anything?
No.
Good. Go ahead and swallow for me. Great. And now what I'll have you do is lean back for me. And then I'll have you look to your left there. And I'm just looking at the jugular vein distension. Just checking for that. And we're good there. So go ahead and look to the left for me with your head, and to the right, and up, and down. Good. I'm going to put my hand on your cheek and go ahead and turn into it. Good. And then turn into it on this side. Great. And then he has a shirt on instead of a gown. But what I'm looking for here is I'm going down here and checking for turgor. So I'm bunching the skin together. It returns right away. Go ahead and shrug your shoulders here. Great. And now what I'll have you do is actually lay back for me. Good. Is your leg okay?
A little sore.
A little sore. Okay. The next thing I'm going to do, and actually I'm going to back up just a little bit. With your ears, you don't wear any hearing, or do you wear any hearing aids?
No, I do not.
Okay. Now I'm moving on to your chest here, and what I'm going to be, I'm looking at size, shape of his chest, the way he's breathing, expansion. And what I'm going to be doing is listening to your lungs, okay?
Okay.
So each time I place my stethoscope on your chest, just take a good deep breath in through your mouth and out through your mouth, okay? So we would pretend that there's no shirt here. Good. Go ahead and move your arm here and do that one more time. Good. And other side. Good. And no congestion?
No
I
congestion.
didn't hear any, but you don't have any congestion with your allergies right now?
No congestion.
Okay, great. Now what I'm going to be doing is listening to your heart, okay? So I'm going to start right on this side, second intercostal space, aortic. Good. Moving across to the left side, the pulmonic, second intercostal space. Moving down to the third intercostal space. And down to the fourth, tricuspid and Erb's point there. And out to the fifth. Apical pulse, which I took earlier, was 58. And I took it for 1 full minute. Great, your heart all sounds good there. And so now, since I have my stethoscope out, I'm just going to listen to your stomach. So again, looking at symmetry, color. And now, with your stomach, have you had any stomach pain?
No, I have not.
And when was your last bowel movement?
This morning?
Okay, and are you having any troubles with urinating?
No.
Any pain?
No.
No problems going?
No.
Good. So what I'm going to do first after inspection is I'm going to listen to his stomach. Lower right quadrant. Upper right. Upper left. Lower left. Good. And now I'm going to be palpating. Let me know if you have any pain or tenderness.
Neither.
No? Just going to keep going here.
When I was at this hospital, I have a therapy dog.
I know. It's our little therapy animal here. She just takes care of her patients. Okay, and so I checked out everything there. We'll do your backside. I'll have you sit up and check your lungs from the back, but we'll do that last, okay?
Okay.
So I'm just, your arms, I'm just checking for sensation, so you can just leave them down. You feel me equally on both sides?
I do.
And how about down here?
Yes.
Good. And then I should go ahead and, normally I'd not have the dog in the way and I'd have him sit up, but go ahead and grab onto both my fingers here and, yep, squeeze, and then pull me towards you and push me away. Good. And then what I'm doing is just looking at nails, color, checking cap refill. Good. And then go ahead and give me a wrist too one more time. Radial pulses. Both are 2+ strong bilaterally. Good. And then just a little range of motion. Go ahead and bring your arms up and down and up and down. And then hands out like this and this way, this way. Great. So no pain or discomfort there. Shoulders feel good.
Shoulders feel good.
Okay, so now I'm going to do the same thing on your legs. So this, your right hamstring is what's hurting you.
Yes.
So sensation-wise though, can you feel me both sides?
Yes, I can.
Great. And can you feel me both sides?
Yes, I can.
Excuse me, Coco. And then I'll be checking pulses. So posterior tibial pulse. And then pedal pulses. Feel them both strong, 2+ bilateral. And then I would take off his socks too and be looking at his toenails, looking for color. And on both sides, I would take off the socks. Now what I'll have you do though is pull your toes back and then push them forward. And then actually do that again. And I'm gonna do it against some resistance. So push like a gas pedal. Good. And push like a gas pedal. Good. And that all feels okay? Even on your right leg?
Yeah, a little discomfort on the right.
Little discomfort on the right side. Okay, so your hamstrings, what's bothering you?
Yes.
Can you do any range of motion? Okay,
I mean, not on my own. It hurts.
okay, so that's painful. And how about on this side?
This side's fine.
Okay, can you bring it up for me?
Yeah,
Your left
go
side?
for it.
Okay, good. And bend your knee. And out. And bend your knee. And out. And then raise it up against some resistance. And so this side is tender even to move.
Yeah.
Okay, so we're not going to mess with that one. What I am going to have you do though is Coco's going to have to move, and I'm going to have you swing your legs around again. I'm going to have you sit up.
Okay.
All right. Sorry, Coco. Great. And then can you scoot forward just a little bit? Good. And I am listening to your lungs again on the back side, okay?
Okay.
So when my stethoscope touches, just take a nice deep breath for me. Go ahead. Good. Again. Again. Good. And again. And one more time. Good. Now, normally what I would do is have him stand up and walk so that I can watch balance and just see how